Now, tonight, a bricklayer on his way home from work gets hit by a truck and loses both arms and several organs. Now, going to hospital, he gets looked after by amazing professionals, doctors with decades of experience, and he cannot be a bricklayer tomorrow. Now, that doctor writes a beautiful report, of course, for the employer to say, look, I'm sorry, but Jimmy is not going to be picking up bricks anytime soon until we get something sorted for this guy. Now, if the employer turns around and says, look, Dr. Bob, I appreciate that you've spent decades of your life training to be an amazing specialist, but we really have developed our own tools to diagnose these sorts of things. So we understand he's on life support, but he's going to have to come to work tomorrow because we're going to do our own assessments, because our assessments we made up ourselves, and they're a couple of months old, and we've decided that they do a better job telling us what we need to know and whether or not those arms are really gone or they're actually still there and you just didn't see. Now, we are going to expect the sort of reaction you'd expect from a doctor if he was told something like that. Now, we are worried in the disability sector that when an NDIS planner, as the CEO has said, doesn't have time to read the clinical reports from the allied health staff, the doctors, the services in a person's life already, where are they going to find the time to actually do those assessments themselves? And are they just going to be administration staff who have done a workshop on how to use a newly created tool that doesn't have decades of evidence-based clinical knowledge and research behind it, like occupational therapy functional assessments? Now, we already have the tools and spend thousands of dollars every year of taxpayer-funded Medicare and also privately funded assessments to make sure that we have the evidence that NDIS needs. But NDIS doesn't have the time to read that. Now, I don't know where they're going to find the time to do those assessments themselves. And we're really worried that those assessments are never going to say, actually, we didn't give you enough funding. We're going to give you more now. I'm not sure or confident that that's the way the system's going to work with these new assessments. And if one of my friends who is a quadriplegic, who has to use a chin control to use his wheelchair, gets a letter from NDIS soon to say, we need to reassess to make sure that your lifelong chronic disability isn't actually better than we thought it was, I'm going to get really upset. And I tell you what, there's a lot of resources and it's going to cost a lot of money to redo a lot of that kind of stuff when we already have clinical assessments ready to go that already demonstrate through professional decision-making and assessment that someone has a disability. Now, hopefully the face-to-face time that NDIS is going to spend doing a review will actually help people by looking at whether their funding is going where it should, is being used the way it should, and people have got the level of support that they need. We hope that that's the way it's going to go. And of course, like any brand new system, there's going to be hiccups. So we're wondering why we need a new system when we already have clinically acknowledged, clinically researched and accepted peer-reviewed assessment tools that are right there being used by professionals today. We are more than 10 years down the journey of NDIS, and still the small things that don't work have not been fixed. We're worried that it may take 10 to 20 years before the assessment tools that are going to get made up now from scratch based on something that's sort of fit for purpose but not really, is going to probably not hit the mark. That's what we're worried about, and I think that's a very valid thing for the sector to be thinking about.